Remember, we keep breaking down these side effects one at a time, but they do come together sometimes, and if you get one, you might get the other one. So the other thing we want to be careful with when your platelets are low is we don't want to get infections. We don't want to get bruises, like we said. So taking those precautions are also for that reason. For instance, wear shoes. Wear shoes at home, wear shoes at the doctor's office, get some comfortable slippers, but protect your feet so you're not clumsy like me and just bust a toe on a corner of a table, because this might be a little more of a problem right now. Okay, so it's just these precautions that you're going to do. Be slow, be careful, and remember you're a superstar. Something else we're going to talk about, we'll talk about in another video, but flossing your teeth. Now, we want to floss your teeth because why? We want to keep infections out of there. So we're going to floss your teeth, but be gentle. Be very, very slow with it. Be deliberate in how you floss your teeth. Don't hurry yourself, don't rush, take it slow. And if you do have a little infection or you do have a little cut because of what's happened to chemotherapy, floss the other parts and leave that alone. You can also, something else you can do is you can take a cotton swab and you can use a cotton swab in that one area. But just be really careful with your mouth. So we do want to floss, but if your platelet count's down, that might be one little period of time that you don't floss for a couple days. You just mouthwash and you just use your toothbrush very gently, or even if the toothbrush is irritating it, 'cause some people's mouths get really irritated, use a cotton swab and be very deliberate and be very careful how you take care of your mouth. Okay, a couple other things when your platelet count is low. You might not want to wear real tight things. You know, those things that are really tight on your wrists or really tight on your collar, the things that are kind of pushing against the skin, because you'll bruise. You might want to wear loose fitting clothes, things that are very, very comfortable. Another thing to be careful with is that you don't want to use suppositories, you don't want to use enemas when your platelet count's down, because you want to be very careful not to cause a bruising again or a slight cut. Even rectal thermometers aren't something you'd want to use during a time period. If you're dealing with your child or you're dealing with even with yourself, it's not something you want to use when your platelet count is down. They have great thermometers to do other ways, and you want to use those. Be very, very careful with these things while your platelet count is low. Last few things that you want to be careful with. And make sure you talk to your doctor, like I always say on all these things, but when your platelet count is low, you really want to stay away from alcohol, okay? You can talk to your doctor about it, but you probably want to stay away from alcohol when your platelet count is low. The other one is sex. You can ask your doctor and talk to your doctor about it, but again, you're really being careful with bruising or any slight cuts or whatever, so you might want to talk to your doctor and ask them. And I know it might sound like it's one of those kind of questions you really don't want to ask, but you do ask. Is it okay to have sex? Should I not have sex? Even during chemotherapy, but especially when your platelet count is low. Last but not least, and we talk about this all the time, is be careful of supplements and things that people will say, well, this is what you do when your platelets are low. You take this kind of supplement or that kind of supplement. Make sure, again, anything that somebody suggests out of the normal routine that you've already presented to your doctor, you want to present to your doctor, your nurse, even if you just got to call them and say, hey, I'm thinking about taking this, or there's a supplement that somebody suggested. For the most part, he's probably going to say no, unless there are some small things that he agrees with. I'm not the expert, and neither are you the expert, and probably the guy down the street's not an expert. Most doctors will tell you that even another doctor's not going to try to suggest something because they don't know the nuances of what that doctor, your superstar doctor, is doing to take care of you. So ending the subject on bleeding or a low platelet count, again, you're going to communicate. You're going to keep communicating with your doctor, but you just need to watch for things. We suggested some, there's others that you can watch for. You can watch for your urine to be kind of a pink or red, kind of a dark colored stool, extra vaginal bleeding or menstrual bleeding. Those kind of things you want to just be watching for. At the end of the day, this is it. I mean, I love that you can get it down to this simple of a approach. That is, any change. Anything is changing. That's why when we start the program, we really try to get a basis of where you're at and what's going on in your life and help you understand so you know what your normal routine is. Okay, when you know where you're starting from, now as there's slight changes, you know what to communicate. So at the end of the day, people are going, okay, I have to remember this, I have to remember that, I'm trying to remember, and you kind of get overwhelmed. Make it this simple. I just have to look for change. When there's changes, I report it. If I'm feeling a little blurry, the vision feels a little blurry, I get a headache, I'm going to report it. That can be a sign of platelet count being low. Do you have to remember that? What you got to remember is if something changes, you report it to your doctor.